Hi friends, in today's class we are going to be talking about HLA typing. HLA is human leukocyte antigen and it is present in every cell in the human body, predominantly class A, B, C, and then we have DR, DQ, DP. Right? What is important for us to understand is HLA C and DQ. These two are the only things which you need to understand because they are heavily involved in the acceptance of the embryo in the human body. How? Remember, when you have uterine decidua, where there are uterine natural killer cells, these uterine natural killer cells actually go to the embryo who is presenting HLA-C through their KIR receptors. Just remember these two things. There are multiple expressions inside this KIR, AA, BB, whatever. HLA-C has multiple expressions, C1, C1, C2, C2. We just need to keep in mind this because when there is a mistake in any of this, that means when the mother is C1, C1, father is C1, C1, that means the baby is also going to be C1, C1. That is going to be a problem to cause preeclampsia in the future. That causes poor implantation. Sometimes you have this C, phenotype 3. Mother is KIR AA and father is C2, C2. That is the most horrible thing. That causes recurrent abortions and everything has an independent treatment associated with it. When do we do HLA typing? Please remember, patient has to have 2 failed IVF cycles, patient has had to have implantation failures. And apart from all of this, pelvis has to be normal, embryo has to be genetically normal. When this HLA report comes to you, the first thing you should do is you should show your doctor because as doctors, we are interested in C1, C1, C2, C2 and if at all we have done a KIR haplotype, then AA or BP, we are interested in that. We divide the patients inside this in all of this. So when you have a father who is C2, C2, I am more worried. I know what immune therapy to offer to my patient. IVIG, intralipids, tacrolimus, thymosin alpha, PLIT, or a combination of all of this can be offered to the patient. Just remember one thing, when both are C1, C1, mother, father, C1, C1, it is a very high risk. Just remember one more thing. If father is C2, C2 with KIR AA, that is also very high risk. Rest everything is manageable. Evidence has been consistently showing that proper treatment in this situation with immune modulation allows patient to have a child with their own eggs and own sperms. Because in India, people are going to recommend you to change the eggs and change the sperm. So please don't do that. Go to a reproductive immunologist. One more thing. PLIT is only indicated when there is DQ sharing on HLA. So don't do LIT for all these types of things. In India, LIT is highly commercialized. You need to be careful. Hopefully, these types of classes are going to help you a lot. Thank you so much.